You may or may not have heard of Burger King medicine, but it is a huge problem in healthcare right now, especially in the aesthetic space. In this episode, we're going to talk a little bit about what Burger King medicine is and how to keep it from biting you. Hi, my name is Dr. Jason Hall. I'm a podcaster and author of the new book, The Art of Aging, Look Great, Not Fake, which is out now on Amazon. You can check out the link in my description or down in the show notes to check out the new book and pick up a copy. So Burger King medicine, what exactly is that? It's really simple. In healthcare, it's you getting it your way right away, even if it's not good for you, much like Burger King. It is the phenomenon in medicine now where Dr. Google is driving our healthcare decisions. We see something online, we hear about something from our friends, and then we go into a doctor's office, and this happens all the time in cosmetic medicine and surgery, asking for a specific treatment that we've heard about. The problem with this is that it may not be the treatment that you need, and it may not be the treatment that accomplishes whatever goals you have for yourself. And on top of that, it may actually hurt you. It may be detrimental to your health and to your appearance. You know, it very much reminds me of the first time that I saw this. It was very early in my practice. I saw a gentleman who came in to see me in the office and didn't really know why he was coming from the little description that we got on his chart until I saw him. And he was African-American, very good-looking guy. He was an actor, and came in and his face looked like a checkerboard. He was horribly disfigured, and he wanted to know what he could do about it. And talking to him, I was kind of learning what had happened. And he had found a Groupon back when Groupon was a thing. I'm not even sure if Groupon's still a thing, but found a Groupon for a laser treatment, which was going to help his appearance. And being a human being, being an actor, of course, that's something that we all kind of aspire to. So he goes to this clinic somewhere and gets a laser treatment. Well, the problem is that whoever was doing the treatment either didn't know a whole lot about the laser platform that they were using, or was just trying to make a sale, and ended up discoloring his entire face. His face literally looked like a checkerboard. He had big dark squares and then little lines and hashes of lighter skin, and then other big dark squares from what this laser had done to him. The reason that happened was that he really wasn't a candidate for the treatment that they were selling. They were just trying to sell it. And it was something that he saw, something that he wanted. And so they sold it to him. The problem with this, and this happens all the time in cosmetic medicine, it happens in my practice almost every day. We have somebody coming in and saying, I want chin liposuction. I want filler in my cheeks. And what we have to do is we have to remember that at the end of the day, cosmetic medicine is still medicine. And one of the foundations of medicine that is drilled into our heads from very early on in medical school is establishing a correct diagnosis, or even a working diagnosis, before we jump to the treatment stage. And with Burger King medicine, the treatment is all we really care about. You're hungry and you want some French fries, you get some French fries. You want a Whopper with cheese, you get a Whopper with cheese. And that causes all sorts of problems. I see patients every day that have had things done that didn't work, that caused issues, much like the laser patient that we talked about. And all of that could have very easily been avoided had somebody stopped, done a history, established goals, figured out what the problem was, why somebody was looking in the mirror and saying, I don't really like what I'm looking at. I want to make some changes to this. I want to change the hollowness under my eyes. I want to change the fullness under my chin. And then diagnosing that correctly, figuring out what's causing that problem, and then designing a treatment plan around that. Sometimes that means saying no. Sometimes that means saying, chin liposuction isn't going to accomplish your goals. You need a deep neck lift. Filler isn't going to accomplish your goals. You need a blepharoplasty. And in this business, if you can't do surgery, then you have to refer that patient out. And of the good injectors that I work with every day out in the community, they will do that. They understand why they're seeing what they're seeing. They understand the anatomy. They understand the aging process, and will say, I'm sorry, I can't really help you. This is not going to make you happy. You need to go see a surgeon. And those treatments, those patients end up being happier in the long run because they have a plan. They understand why they're seeing what they're seeing. And then they understand what the treatment plan is designed to fix. It's not a quick fix. It's what their body actually needs to reverse the aging changes that are there. So if you are interested in cosmetic treatments, make sure that you're doing your homework. Go in with a set of goals. Look in the mirror, see if you can figure out for yourself what exactly it is that bothers you, and then go see somebody with that in mind instead of going in and saying, I want treatment X, I want procedure Y, because that will keep you out of trouble and will help make sure that your experience in cosmetic medicine and surgery is as best as you can make it. So thank you for listening. Check out the book on Amazon. It's called The Art of Aging, Look Great, Not Fake. And if you have any questions, have any ideas for another show, please shoot me an email, info@drjasonhall.com, or shoot me a DM at Dr. Jason Hall, and we'll see you on the next show.